So good, we'll be looking at history taken for patients with coronary artery disease. Alright. So for the history taken, it's not that we are going to now go about all those names, all those things. Right. We assume that everybody watching this video already know all those basics for taking history. That's trauma, clacking of pain, and all this stuff, right? But for coronary artery disease, there are some questions that you must ask. There are some things that you must inquire about, okay? So that those are the things that we're trying to project in this context, okay? So history taken for patients with coronary artery disease. So coronary artery disease is mostly like it could be that the coronary artery is like constricting on itself. It could be that there's a mechanical something blocking it, or it could be that there's deposition of fat, like there's deposition of fat on the walls of the coronary artery. Okay, all these things can constitute a coronary artery disease, right? So you try to ask the patient if they are having a retrosternal pain or discomfort. So you are trying to now note the location of the pain. So if they tell you that it's not retrosternal, then you should point where the pain is at. Okay. Now you try to know the precipitants, like what the patient is doing that will now worsen the pain. Is it that is when they do exercise or any strenuous activity? And what is the thing that they do for the pain to now relieve? Is it when they rest? Is it when they lie in a particular position? You try to inquire about all that. Now, pain and discomfort may be described as either constricting, tightening, squeezing, crushing, occasionally as what? Burning sensation. So you try to now ask the patient to describe the type of pain they are feeling. Alright. So pain also could radiate to the ulnar surface of the left arm and the outer surface of both arms. Okay. So you try to ask the pain, try to ask the patient for, okay, if the pain is starting at this part of the chest, does it go to another place? Right? That's what you try to ask them. Then angina equivalent, you ask them if they are having difficulties in breathing, if they have ever fainted through the course of the disease. Then also ask them if they feel weak. Alright. Then you also take history of what risk factors, like do they have hypertension? Do they have a high blood pressure? They also take history of what do they have diabetes, right? So these are the things to note when you're taking history for patients with coronary artery disease.